Hello, everyone. It is April 3rd. We are here live from the Emergency Operations Center, Montgomery County. We have Public Health Director Sarah Baranco here with us today, as well as Sheriff Jeff Smith. We're going to be providing this briefing and giving you the latest information as we have it. We now have 12 confirmed cases in Montgomery County. And Sarah's going to talk a little bit about that as we move forward. And I'd like to touch on a couple issues related to testing and resources. Very proud of the team. We've been working for weeks now to try to get more tests. Obviously, we acknowledge and understand that the testing is absolutely critical and we need to be doing more. We initially got 50 from the state as our first allotment and some additional after that. But we really tried to do what we can to get more. We actually purchased 150 tests from Montgomery County. These were not part of New York State or the Office of Government Relations. These were purchased by Montgomery County, and our county was not part of the mass distribution plan for the state. So we're trying to supplement those resources with resources of our own, because we know that testing is the best weapon we have to fight this. And once we know someone is positive, then we can take the proper steps and make the phone calls and really try to fight this through that testing. So we're very happy to have that, and that will be put into action. We've had some partnerships with local doctors and obviously the hospital. Also, just like to address the fact that we are starting to get some supplies in more and more. We just had a nice shipment of N95 masks, gloves, other masks, and things of that nature. And within the state, resources have been coming into our emergency management office, and we're getting those out as soon as we get them. So if you're out there in the community and you need supplies, it can't hurt to ask. Give us a call up at the emergency management office, and we'll do our best to fulfill your requests. Without further ado, we're going to turn it over to Sarah to give her latest update from Public Health.
Thanks, Matt. So as Matt said, even as early as this morning, the number has changed. I was on the radio WCSS this morning, and at that point we had 11. Upon my return back to the office, I was given the update that we have 12 confirmed cases of COVID-19 in Montgomery County. Just to give you an update on those patients, 4 of these patients have made a full recovery, and they have finished their quarantine process, and they are back to normal, typical everyday lives. 3 of these folks remain under medical care, and 5 are now placed on a home quarantine for their 14-day period. Further quarantines, we have approximately 35 folks on mandatory home-based quarantine as a result of exposures to folks who have tested positive. And we know that folks are really concerned and asking questions about where these individuals live and where they are. I can tell you that we have people on home-based quarantine all the way from Amsterdam straight through to St. Johnsville and everywhere in between. So it doesn't matter the exact street address that they live on. It just matters that you know that we have at least one person in every municipality from Amsterdam straight through to St. Johnsville. We're getting questions in reference to the folks from New York City downstate coming up to our hospital. My talks with the hospital have been very good. They have been very informative. They are working with these patients, and we have to remember not all of these patients are COVID-19 patients. We are being asked as a hospital to take patients who need medical care. Sick people belong in the hospital. People who have had open heart surgery, need liver transplants, are on end-stage dialysis. People who are having babies, they all require medical care. So it's not just COVID-19 patients that are being shipped from New York City to different places in the state. We are looking at non-COVID positive patients. We also have been asked about the number of ventilators that we have available in Montgomery County. Currently, we have 19 that are available for our use should we need them. So we have a good supply here in the county. We have positive patients who have received flu shots as well as pneumonia shots. So that was a question that folks were concerned about. Are we treating pneumonia? Are we treating flu? Yes. We still have other things happening in the county other than COVID-19. We are still treating pneumonia. We are still treating the flu. We are treating the co-occurring disorders that folks have. So I want to be clear that this is not just all COVID-19 patients who are utilizing the resources that we have in the county. One other question that people wanted to know was what would happen if my child was sick and tested positive for COVID-19 and needed hospitalization. There are rumors obviously floating around on Facebook and memes and of that nature. I'm here to tell you that we don't know what would happen. That is a state regulation. So it is going to depend on obviously the care and the level of care that your child needs. We know that in New York State, parents cannot be left out of medical decisions made for their child. So if your child was to be hospitalized for any reason at all, you would be included in that treatment plan and in that planning process for that child. We are asking that if people have had a contact with a positive patient or you have come in contact with a COVID-19 patient that you know for certain is positive, to please call our office. Again, our number is 518-853-3531. The executive alluded to the testing, and I'm here and proud to say that as of today, we have the capacity to test and open up testing for community. Please be aware that these tests are for only those that live in Montgomery County. Unfortunately, we do not have the resources to test folks that do not live and reside and sleep at night in our county. So if you feel that you meet the criteria for COVID-19 testing or your doctor is talking to you about getting a test, that will be facilitated through our office. Again, 518-853-3531. At that time, when you call, we will do a extensive health screening with you. We will ask you a number of medical questions, and then we will assist in making that process seamless. And I can tell you, as of today, we've already utilized that twice. So it started at 9:30 a.m. this morning with the training of the staff, and we've already had 2 people utilize that service, and it's only 1 o'clock. So we are moving along in the right direction as far as testing. Folks have asked me about the exact number of people in our county that have been tested. And to that, I can tell you, we don't know because people are not remaining in their county of origin to get tested. So again, if somebody seeks testing in another county, such as Albany, Schenectady, or Troy, we don't have the capacity to track those numbers because they are not reporting the exact number per county that is being tested until after we get the results of that test back. So we may have had 1,000 people that went to another county to get tested. We will not have that number until those results come back to their home county. So I know that's a little disheartening and concerning for some people, but that's the reality. We don't have that exact number. The last question that I just want to go over quickly is what the quarantine and isolation period is. It is a 14-day home-based isolation where you would be remanded at home, not to leave your home, and if you needed supplies, groceries, pharmaceuticals, any other kind of item, you would be asked to work with a family member, or you could call our office and we would assist folks in getting some of the basic necessities that they need. As always, if you have questions, please don't speculate, please call me. Thank you.
Thank you, Sarah.
Thank you.
Thank you for everything you're doing. And I think the big takeaways from that is we're doing more testing.
Yes,
And we're doing that because we found a way to get our hands
correct.
in the marketplace
Absolutely.
on more tests.
Right.
You know, we were able to get 150 in the state, coming in with 50, now we have 200. We're in a lot better situation than we were a week ago. So
Absolutely.
we're gonna continue to do everything we can. And I think the same goes for the folks at St. Mary's and all the local officials that are making decisions relative to people coming up from downstate. Obviously, it's a big concern, but people have to keep in mind, New York City and the tri-state area is the epicenter of this outbreak for the entire world, and we are 3 hours away.
Correct.
It is going to have an impact on us, but we've had really good calls with St. Mary's, and obviously we are gonna always fight for our residents and make sure that they get the care they need, that they're protected, that, you know, we do everything we can, and that is going on, and we're all trying to make the best of what is a very difficult situation, and it's starting to look more and more that, like, this is becoming more of a marathon and not a sprint, and it's we just got to keep plugging away. And with that said, we wanted to have the sheriff here today to talk a little bit about you know, his experience and some of the questions he's been getting, and also talk about a little bit about, you know, issues related to enforcement and things of that nature. So, Sheriff, please feel free.
Thank you, Exec. First, I'd like to thank Director Sager from Emergency Management, Director Branco from Public Health, and the County Executive. I see firsthand how hard the three of you are working and the dedication that you've provided during this. And I know it's not easy. I think first and foremost, I wanted to reiterate to the public, because we get this question all the time, that there is no specific travel ban. With that said though, there also is no unnecessary travel. So I know that's a little confusing and hard to understand, but we want you to realize if it's necessary and you need to do it, it is acceptable to do it. There is no specific travel ban. Next thing I want to talk about are some changes in our office, as I'm sure most people may have noticed by now. The four main divisions in our office, the jail, patrol, our 911 center, and the civil office. We've worked very hard to try to open our office back up to the public and encourage the public to come to us. And now we've had to do a role reversal, and we've shut the lobby and the office down. So I assure you, first and foremost, that we will open it back up again when we all make it through this. But in the short term, there is no visitation in the jail. Nobody in and out of that facility. Our correction officers are very important to us. We're working very hard to keep the inmates safe and healthy, and our correction officers safe and healthy. We're doing arraignments by Skype. We're using computer equipment so that there's no travel, no unnecessary travel by the inmates. And those situations in the facility are very difficult because people are coming off the street. We don't necessarily know exactly where they're coming from or what situation they were in prior to their arrival. So our policies and procedures are very tight, very controlled, and staff has been trained and they're doing an excellent job. On the patrol side, again, PPE is very important, gloves, masks. We're doing okay equipment-wise. You may notice a patrol deputy that has gloves and a mask on, and you wouldn't normally see that. They may ask you to come out and talk to them outside instead of entering your home. They may ask you to call on the phone instead of them responding to your home. All these things are a little different for us, but it's just a way to keep our staff safe. Remember that when the men and women are working in the county responding to emergencies and police calls, they still also have to try to stay healthy and go home at the end of the day. So, they're doing both and trying to balance that and still provide a good quality service. Our 911 center, if you call into our 911 center and you are experiencing a medical issue, you will be asked a questionnaire. You may be asked to meet the ambulance or the first responder unit outside your home if you're able to. That is unusual for us. Normally we just ask what type of issue you're having and send the appropriate people. So it's a little more exhaustive, but please be patient with our staff. Understand that there's a reason behind these questions and it's to benefit everybody at hand. In our civil office, I know there's a lot of people that want to process their pistol permits and they have work that needs to be done. Right now, we're handling phone calls and some mail, but most of the work out of the civil office has been paused during this. We encourage people to stay informed, practice your social distancing, practice the universal precautions, be familiar with the executive orders as they come out from the county executive or the governor. Follow those. It's a different way of living. As you know, we can't have any large groups, no parties, no gatherings, closures of specific businesses. We have been receiving numerous calls and complaints through social media and our dispatch center about places that aren't necessarily following the executive orders, maybe still remaining open, maybe trying to stay under the radar and have some people coming in. Please don't put us in that position. This is an epidemic for all of us, so we all need to follow these rules. Please obey these executive orders, understand what they are. If you have questions, call. We can try to help you. I know the executive's office would help, the public health department, emergency management, get you in touch with the governor's area office to get clarification. But follow those executive orders. Don't put us in a position to come and have to try to close you down or eliminate a gathering that's taken place. And I think the last thing that I just wanted to share is during this difficult time when people are out of work and maybe not receiving a paycheck and struggling getting to the grocery store, we have a new program out there, thanks to Morgan that helped promote it, that we can pick up some food for the food bank and get it to needy families. So research the social media pages and look at the information out there.
Yep.
So we can get some help.
Appreciate that, Sheriff. We had, we want to reemphasize that the county social media, municipal social media, our county website, we're putting all that information out there for you. And the sheriff brings up a good example. We just had, and we're doing this constantly, we had an issue with a business that was open that fell under an exemption. On the look of it, it said, why would this be open? But they did fall under an exemption, and then we brought that up to the governor's office, and then the day later, there was a lot of people bringing it up. It came down that business had to close, and that exemption was eliminated. So that information is even coming to us very quickly, and we're trying to do our best, and what we're going to do is to get it out on that social media first, on our website first, then get it into the papers. You can count on Sarah being on the radio every Friday at 9 o'clock to 11 o'clock, answering question after question after question. Then we followed up with this briefing. We've also been utilizing the hyperreach to try to get to our seniors who might not have the internet, let them know what time they can listen to the radio. You have coverage throughout Montgomery County on the radio. So if you have some seniors that you know that aren't doing social media and aren't getting the newspapers regularly, to let them know that they can listen to Sarah for 2 hours every Friday, be brought up to speed on what's going on. We even took an ad out in the local My Shopper to try to get the word out about that. So those are the means in which we are going to continue to try to get the word out. But before we wrap up and take some questions, I'd just like to say that, you know, we started with 50 tests. Then there were some more that came into the state, but now we got 200. And you see the curve that the governor's talking about, and you see where we're headed. It's important to stay positive, and we're going to keep sharing positive stories and try to do the best we can there. But we all need to understand that the next few weeks are probably going to be very difficult for a lot of people in this community, and people are going to be really affected by this and are being affected by this as we speak. So now's the time to keep digging deep and being there for one another. Like Jeff said, you know, they're here to help. The Office for the Aging is here to help. We're putting up constantly the way people are coming together. There's a lot of positives out there, but I think everybody needs to be in mind that this is going to be a couple weeks of some very difficult situations going on in our community, from St. Johnsville to Amsterdam. All the way. And there's no one community that's without this at this point. So we're in the thick of it. We just got to keep plugging forward, find our wins each day like we've been trying to do. It was a big win for us with the testing. We cannot tell you how relieved we are. We hear a lot about it and the people's concern about it, and we're doing everything we can. Morgan, do we have any questions from? Okay. Good.
May I before I forget about the hyperreach? Hyperreach is a mass notification system that emergency management and the sheriff's office share. It's a great tool, so we encourage as many people to sign up as possible. And you can go to the county website, to the sheriff's office page. There's a link right directly to do it, or call us. We'll help you through it. Secondly, we sent out the message last night. You will see that phone number call right now from a 585 area code. That's because that's physically where the company is located. We're working on changing that to a local number. And if it scrolls across maybe Spectrum on your TV, it will say 911. That is not spam, that's coming from the sheriff's office. But we're gonna try to fix that to make it a little smoother.
And we had how many people sign up for that since our last?
About 1,200 people since,
So that's great.
middle
Keep
of
spreading the
March.
word. You know, when something needs to go out immediately, we're going to keep utilizing that. That's why we have it. And it's a great tool to get the word out there about specific things, especially to our seniors.
And some listened in this morning on the radio, and when they called, they said that they had heard our message, and they were very thankful for that, so it is working.
The more, you know, we want to get all the information out, all the guidance out. We encourage everyone to follow the state guidance and try to get everybody on the same page so we can all handle this together as a community, and that's what we're doing. So, Morgan?
Sarah, could you maybe give a quick recap of the statistics of our numbers for those who just tuned in?
Absolutely, I'd love to. So currently we have 12 laboratory confirmed positive COVID-19 cases. That changed from this morning when I woke up at 5 o'clock this morning. We only had 9, and so throughout the course of the past 4 hours we've gotten some more. Out of those 12, we have 4 patients that have made a full recovery, finished their quarantine process, are doing well. We have a patient, if you're watching, thank you, because she calls every day to tell us how grateful she is, and she talks to us and gives us updates on what's happening with her. So they're going back to their normal everyday lives. We have 3 of those 12 who remain under medical care, and we have 5 that are currently being monitored and continue to be monitored under home-based quarantine. 35 folks, not inclusive of those 12, are on home-based quarantine and will be finishing up their 14-day home-based quarantine, within the next, obviously, 14 days at some point. So that number is ever fluctuating. It is very fluid. And as the executive said, we did just acquire 200 testing kits. And I want to just talk a little bit about the kit of what it looks like. So it's a vial, a medium. It's a nose swab, and then that vial and that medium and the sample is put into a plastic medical bag with the patient's label ID number, and then it is put into another padded bag to be ready to send out to be shipped to the lab. So when we're talking about what these kits look like, there are a number of different components that are very important for tracking purposes. Everything has a barcode. It's labeled with a patient ID number, the sample in bags to protect it from being damaged in shipment.
Are there any stats on whether the antibodies from a recent flu shot will give short-term protection from COVID, since two viruses that don't exist in the same spot host simultaneously?
That's a really good question. I actually just read an NIH study a few days ago that had said that the new plasma blood test that is being developed will actually give us some more insight onto that. We know that it's very, very unlikely that you can have two viral infections at the same time. Not to saying that it doesn't happen. Somebody has to be that 1 in a million in order for us to have that statistic of 1 in a million. But those statistics are rare to have that. So we are actually hopeful that because of the technology we have with this plasma test and the flu shot as well as the pneumonia shot, that we have the capacity to look at that for further research. So the NIH is working really hard on that. And if you're interested, Tony Fauci, who is the lead of the infection control, he's an amazing doctor. He has put out a lot of posts and podcasts and studies around that issue.
He's the favorite in the Austin Fort House. We love when he comes on the news because he's so informative, and he tries to have a positive outlook but also give you the facts.
Yeah.
So we're big fans of his.
And I like him because if he doesn't know, he'll tell you he doesn't know.
Exactly.
He doesn't try and make up an answer. So Dr. Fauci's really great, and he is the lead in his field.
Well, and Sarah, I imagine that this is going to change and evolve as we go, and whether it's the antibody testing and things like that. You know, this thing is going to continue to change, and I think we've seen that even from when we first started.
Absolutely.
Just getting the tests. Now we're trying to get more tests, more resources, and that's a battle that's not going to go away anytime soon. So.
And there are hospitals. I know Cheryl Reese shared with me a link that she found through Mount Sinai Hospital, and it was a survey that people were filling out to talk about symptoms and symptomology and if they had recovered from COVID-19. And it was really fascinating that already Mount Sinai has started and really taken a lead on that. So Cheryl and I looked at that, and we went through some of the different steps that a patient would have to go through in order to be deemed a person that could be part of that study. So if you have free time, the Mount Sinai website is a really great resource.
Is there any way the county would be able to enforce the amount of people inside stores at any given time?
So I'll take that one. So it's a challenge. Right now we have, the state has set up their guidelines and executive orders, and we are to report different issues to the state. However, locally, we're looking at what we can do. It's a challenging situation. We might have to look at some different executive orders on my behalf, and have some talks with the district attorney, which actually we are having right now, on what to do. But we really want to emphasize to people, some of it, the large grocery stores, there's going to be some things we can do and some things we can't. We're trying to work with everyone on an individual basis to try to educate first and inform people first, and then try to get to the enforcement piece. But it's not a perfect science. This isn't your everyday traffic accident, Sheriff. It's a little more complicated.
And as this adapts every day, some of the stores are starting to take initiative and take some actions themselves. We've seen that firsthand, where they're actually marking floors on where you can wait in line, and they're limiting access to the doors and controlling how many people go in at a time. So I think as this continues to adapt, things will continue to improve, we hope, as we learn each day.
Yeah, because it's new for everyone.
Yeah, and Sheriff, if you could just talk a little bit about some of the scams, people have been questioning me as to how I found the lab and why it took me so long to decide on a lab to purchase kits from. And one of the things that we've been experiencing a lot at our office is scams. So, we get phone calls saying, I have 50,000 masks. If you can give me a credit card number right now and give us 5,000, we'll send you 50,000 masks. Or I developed this test and we'd love to give it to Montgomery County. If you can just give us a account number. So I'm really concerned about some of the scams that are happening. And it's even gone to the point where we have had folks pretending to be like contractors or folks who work in an industry where they have equipment that we might need, calling us from these strange phone numbers, saying that if we meet them someplace, they'll give us all of this stuff for $1,000 cash. So it's running the gamut. So I am concerned about some of those scams.
Sadly, that's exactly what these people do, is they take advantage of people during a time of need. So they're watching the news as well and trying to learn what we need locally and then calling people and taking advantage of that situation. We shared a great PDF, JPEG image of scams on our social media page that was shared with me. So I thought that was good, but the basic rule is if you are not reaching out to a company that you have done business with before, or you know exactly who you're talking to on the phone, never, ever, ever give out your credit card information, your bank account information, social security number, date of birth, transfer money, send gift cards in lieu of equipment being shipped back to you. If you have questions, call your local law enforcement first and foremost, and let us help you investigate that. If it's a company that pertains to PPE and public health can assist you, call them. But it's so important to know who you're talking to on the telephone, or where that mail is coming from in the mail, or who's knocking on your door. That's why we are here, to serve the public. Don't ever be afraid to call.
I would agree wholeheartedly. I cannot believe some of the things that I'm seeing, and you've been in this longer than I have, Sheriff, but it's mind-boggling. And at a time when you have such a great need, which is why we're so happy when we see those legitimate shipments actually come in the door like they have recently, both from the state, but also our DPW Commissioner Eric Mead has been scouring to try to get supplies, and we've been sending shipments to municipalities, nursing homes, you name it, individuals. I ran into a nursing home or a funeral home owner last night while I was picking up dinner and said, I need this, and we'll send it out the next day. So, it's a tough situation.
And companies are getting creative. I know one of the scams that we were able to bypass was there is a company that we work a lot with. It's called Med Alert, ALERT, and we were getting spam mail from Med Alert, ALART. And so if I hadn't looked deeply into that, it might have been one of those companies where we placed an order where we typically would with Med Alert. They're just somebody we use often. So they're even getting creative. So I just want people to be wary. If it sounds too good to be true, it probably is.
Someone asked about, is it true if the National Guard is coming to make sure people follow quarantine rules?
As of right now, I have not, certainly not in Montgomery County. I've been in contact with the governor's office on a daily basis. And again, a lot of that is trying to clarify the different guidance for the sheriff or maybe for public health or whatever it may be. But no, as of right now, we are not aware that the National Guard is coming into enforce.
Someone mentioned that some of the Amish community is still having their school, church, and youth group events taking place. Any thoughts on this? Or
I can tell you that I've been working with the Amish community. Some of the auction houses and some of the grocers have called me personally, because one of the things that the Amish have said to us is they don't want an issue with law enforcement or breaking the law. So we have been working with the Amish folks on their auctions. They have an equipment auction coming up at the 17th of April, and we spoke yesterday about if that was still a possibility to continue. And they have actually been really good about following our rules. There was an Amish store that was having a sale on some items that we actually needed, and we went to that store and purchased some medical items that we needed, and they only let 3 people in the store at a time. So my staff and I experienced that firsthand. So they actually have been following some of the rules.
And I would just like to emphasize too, a lot of times, we're gravitating towards people that aren't following the rules. there is a great majority of people that are.
Because they're fearful.
Yes, exactly, but you know what, there's a lot of people that are, we need to continue doing that, we need to continue trying to talk to people, half of this is education, people are very nervous, very scared, and then there's others that, you know, maybe aren't taking it as seriously, and we just gotta keep trying to, as a community, relay the information and explain to people why this is important, and I think the longer we go in this, it's gonna become more clear and more clear why it is so important, but we are looking for local enforcement options that we can have at our disposal moving forward, and that's a conversation that's ongoing right now.
Yeah, we should be clear that we do not want to be put in that position.
Exactly.
We're here to serve the public, we're here to give you guidance, we're here to share information. If we have to respond, we certainly will, but we would peacefully say, please,
Yeah.
obey the rules.
Well, and that's what, up to this point, a lot of that has been your officers taking the extra time to explain things to people, provide the backup information. But there's gonna get to a point where, you know, we need people to do what they need to, they're supposed to do. There's very clear guidance on what you can do and what you can't do from the state. And again, if you have any questions, refer to our information we've put out there or give us a call. That's what we're here for.
Someone asked, do you have anything for designated shopping days determined by the letter of your last name?
We don't, and a couple people have asked if that would be a great idea, and I have suggested that to a number of our local stores. I know Aldi's had reached out to us when this first started in reference to what they could do to assist with crowds and groups. We don't have anything in writing, but some of the places that we are working with are actually saying, you know, seniors are allowed to come in from 6 to 7 in order to allow them to shop earlier. And there are other places that are abiding by a last name rule, but it's not an overall general rule.
I don't think we have any more questions.
Sheriff, any last thoughts?
No, I mean, the only thing we continue to say, and it sounds like a repetition, but that's important during these times, please contact us, ask questions, reach out. Don't be afraid to ask a question more than once. We're here to help you, we're here to provide a service, and there's a lot of people here that are very good at what they do and rely on them to give us the information we need.
And we take calls for non-COVID related things too. I just want to put that out there. It is rabies season, so if you're outside and there's animals coming out, please be wary of those too. And you can call us for things that are non-COVID related as well.
And lastly, I will say, we didn't get any questions on it, but no new information on schools. But again, judging by where things look, I wouldn't be surprised if we see closings extended. And I'm going to finish today with pulling from your frequently asked questions because I don't think I can say it any better. So please remember, the more people that disregard social distancing and self-monitoring, the longer this will persist. You can go outside, you can ride a bike, you can go for a walk, you can engage in activities where you are not coming into close contact with others. And I think that's going to be important as we go on, because you're going to have to get outside. It's going to be warm. There are activities that you can do, but be smart about it. Use common sense, but also be mindful of the elderly. We know this is impacting our seniors. Please help keep them safe. Call your elderly neighbors and relatives and check on them. That's always a good rule of thumb. And lastly, I'd just like to thank everyone in Montgomery County that's doing the right thing. Keep working hard. We're in this together, and we will get through this. We will come out on the other end, but until then, we gotta keep our head down and keep doing the right thing. So everybody take care of yourself and be safe, and we'll see you next Friday.
Have a good weekend.
Thank you.